Phlebotomy Chapter 1 Introduction to Blood Collection. Laboratory results constitute 70% of the objective information for healthcare providers. 56% of laboratory error occurs at the pre-examination phase of testing. The influencing factors are the monitoring of specimen ordering, patient identification, patient communication and safety, patient preparation, timing of collections, equipment, collection technique, specimen labeling, and specimen handling, transport, and processing. Technical and non-technical factors are important when collecting a blood specimen. Regulatory issues include both governmental and public agencies, provide safe and effective health care. Clinical Laboratory Improvement Amendments, CLIA, administered by Centers for Medicare and Medicaid Services, Food and Drug Administration, classifies tests. There are waived tests, moderate complexity tests, high complexity tests, and provider-performed microscopy procedures. Waived testing requires no special training or education. Little risk of error. An example is a urine pregnancy test. Moderate complexity testing. You must have a high school diploma and documentation of training in certain areas. Examples: complete blood count, or CBC. High complexity testing. Clinical laboratory science degree required. Tests require a high degree of interpretation. An example is a urine culture and susceptibility. PPMP, or provider-performed microscopy procedure. Microscopy performed by a physician, mid-level practitioner, or dentist. An example is a microscopic urinalysis. Accrediting agencies: the Joint Commission or the TJC. Independent and not-for-profit. Accredits and certifies healthcare organizations. The College of American Pathologists, or CAP. Board-certified pathologists. Provides laboratory accreditation and proficiency testing for hospital laboratories. Commission on Laboratory Assessment, or COLA. Physician-directed agency. Popular with physicians' office laboratories and independent laboratories. Consists of representatives from laboratory, industry, and government. Develops and publishes standards for laboratory procedures. Standards of care. Legal considerations. Blood collection events that can initiate litigation. Nerve injury, hemorrhage, caused by accidental arterial puncture or inadequate pressure to vein. Drawing from inappropriate sites. Injuries occurring when a patient faints. Misidentification of patient or specimen. Wrong diagnosis or mistreatment and death of a patient can occur from this. Health Insurance Portability and Accountability Act, or HIPAA, was enacted in 1996, protects privacy of patients' health information, and maintains confidentiality. HIPAA violations that could involve litigation. Accessing patient files without a need to know. Leaving patient information visible to others. Giving patient results out to family members without patient's consent. Confidentiality. All healthcare professionals are legally required to adhere to patient confidentiality. Patient or healthcare provider communication. Verbal statements made by the patient. Patient's chart or test results. Test results are only given to healthcare provider. Patient consent. Patients must provide consent before any procedure. Informed consent. The procedure must be explained to the patient in terms they will understand. Patient must believe healthcare professional is competent to perform the procedure. Failure to obtain consent can lead to legal issues for the healthcare professional. Expressed consent. Primarily required for invasive procedures. Express consent in writing is safest method. Verbal consent must be documented in patient chart. Implied consent. Very common in phlebotomy. Patient gives consent by extending his or her arm and rolling up their sleeve. Consent for minors and incapacitated patients. Parent or legal guardian must provide consent for minors. Legally responsible person must provide consent for patients who are mentally incompetent, patients in shock or trauma, patients who cannot communicate or are under the influence of drugs or alcohol, and patients with dementia. Chain of custody. Test results used as evidence in legal proceedings. Documentation of specimen handling required. Special forms and special containers used. Common tests are blood alcohol, drug levels, and DNA analysis. Chain of infection. Infectious agents include bacteria, fungi, parasites, and viruses. Reservoirs are humans, animals, insects, fomites, blood-body fluids. You can break the link by disinfecting and hand hygiene. Portal of exit, nose, mouth, mucous membranes, and specimen collection. You can break the link here with sealed biohazardous waste containers, sealed specimen containers, hand hygiene, and standard precautions. Means of transmission: droplet, airborne, contact, vector, or vehicle. You can break the link here by hand hygiene, standard precautions, PPE, and patient isolation. Portal of entry: nose, mouth, mucous membranes, skin, unsterile equipment. You can break the link here with hand hygiene, standard precautions, PPE, and sterile equipment. Susceptible hosts: patients, elderly, newborns, immunocompromised, and healthcare workers. You can break the link here with immunizations, patient isolation, nursery precautions, and healthy lifestyle. Healthcare-associated infections: an infection acquired by a patient as the result of a healthcare procedure. Acquired in all healthcare settings. Number of antibiotic resistance associated organisms is increasing. 3 most common healthcare-associated antibiotic resistance pathogens are MRSA, Enterococcus, and Clostridium difficile. Wear appropriate personal protective equipment. Change gloves between patients. Sanitize hands after removing gloves. Use only needles with safety devices correctly. Properly dispose of sharps in puncture-resistant containers. Record all accidental needle sticks and exposures following OSHA exposure control plan. Start post-exposure prophylaxis or PEP as necessary. Observe isolation techniques. Bloodborne pathogens: HIV, hepatitis B virus or HBV, hepatitis C virus or HCV. Standard precautions must always be strictly followed. Disinfect objects daily or when visually contaminated. Always wear PPE. Gloves: OSHA and CDC mandate. Change gloves between patients. Hand sanitizing after removing gloves. Alcohol-based hand sanitizers, not for C. diff infections. Other personal protective equipment: gowns and lab coats, masks, goggles, and face shields. Respirators: NIOSH approved respirator N95. Sharps hazard. Requires employers to provide sharps with engineered sharps injury protection features. Variety of safety devices for needle disposal are available. Disposal of all needles, syringes with needles attached, winged blood collection sets, and holders with needles should be directly disposed into a puncture-resistant container. Specimen processing. Centrifugation. Separates the serum or plasma from blood cells. Capped, balanced tubes. Firmly fasten the top down before starting the centrifuge and never open the top until the centrifuge has come to a complete stop. When a tube breaks in the centrifuge, immediately stop the centrifuge and unplug it. Apply PPE. Completely empty the cup where the broken glass is and disinfect the cup. Clean the inside of the centrifuge and disinfect. Broken glass must be deposited in a puncture-resistant container. Specimen aliquot preparation. Portion of a specimen that is placed in a separate tube. Cover stoppers with gauze and twist them instead of popping them off. Never pour samples from one tube to another. Use disposable pipettes to transfer sample. Use plexiglass shield. Specimen transporting. Primary container, secondary container, labeling, leak-proof containers. Outer container should have a UN 3373 label. Biological substance is category B. The primary receptacle contains the specimen. It should be leak-proof or sift-proof. Liquids should be wrapped in an absorbent packing material. A secondary packing, leak-proof or sift-proof, e.g. sealed plastic bag. There should be a rigid outer packaging. The outer packaging should include a name and telephone number of a responsible person. Post-exposure prophylaxis. Draw a baseline blood sample from the employee and test it for HBV, HCV, and HIV. If possible, identify the source patient, collect a blood specimen, and test it for HBV, HCV, and HIV. Complete testing within 24 hours for maximum benefit from post-exposure prophylaxis. Follow steps in box 1 through 5 if patient tests positive for HIV, HBV, or HCV. Quality management. Ensures quality patient care, reliable results, and effect of blood collection on laboratory results. Phlebotomy Chapter 1 from the book, Introduction to Blood Collection. Aliquot. A portion of a specimen. Chain of custody. Documentation of the collection and handling of forensic specimens. Clinical Laboratory Improvement Amendments, or CLIA. Federal regulations governing laboratories that test human specimens. Clinical and Laboratory Standards Institute, or CLSI. Nonprofit organization that publishes standards and guidelines for clinical laboratory procedures. Healthcare-associated infection. Infection acquired by a patient as the result of a hospital stay or an outpatient procedure. Health Insurance Portability and Accountability Act, or HIPAA. Legislation that guarantees the privacy of individual health information. Pre-examination phase. Process that occurs before testing of a specimen. Sample. Portion of a body fluid or tissue taken for examination, such as an aliquot of plasma or serum. Specimen. One or more parts taken from a system. The Clinical Laboratory Improvement Amendments are federal regulations administered by the Centers for Medical and Medicaid Services, or CMS, and the Food and Drug Administration, or FDA. CLIA stipulate that all laboratories that perform testing on human specimens for the purposes of diagnosis, treatment, monitoring, or screening must be licensed and obtain a certificate from the CMS. This includes all independent and hospital laboratories, physician office laboratories, health clinics, and mobile health screening entities such as health fairs. Laboratories with CLIA certification are inspected to document compliance with the mandated regulations. The inspections may be performed by the personnel of the CMS or an accrediting agency recognized by CMS, including the College of American Pathologists, or CAP, the Joint Commission, or TJC, COLA, INC, and the AABB, formerly American Association of Blood Banks. The Clinical and Laboratory Standards Institute, or CLSI, is a global nonprofit organization that publishes recommendations by nationally recognized experts for the performance of laboratory testing, including blood collection. CLSI standards are considered the standard of care for laboratory procedures. Procedures for specimen collection and laboratory testing are written in accordance with these standards. In a legal situation, they are considered the standard of care that should have been met. The AABB is an association that provides technical development of regulations involving blood and certifies blood banks and transfusion services. The College of American Pathologists, or CAP, is an organization of board-certified pathologists that provide laboratory accreditation and proficiency testing for hospital laboratories. COLA is a physician-directed accrediting agency popular with physicians' office laboratories and independent laboratories. The Joint Commission is an independent, not-for-profit organization that accredits and certifies healthcare organizations. Airborne pathogens include tuberculosis, measles, chickenpox, herpes zoster shingles, mumps, adenovirus, and COVID-19. PPE for airborne pathogens is standard precautions, mask, or respirator. Droplets are infection with Neisseria meningitis, Haemophilus sp, pertussis or whooping cough, Group A streptococcus, influenza, rhinovirus, scarlet fever, parvovirus B19, respiratory syncytial virus, COVID-19, and diphtheria. Use standard precautions and wear a mask. Contact: Clostridium difficile, rotavirus, draining wounds, antibiotic-resistant infections, scabies, impetigo, herpes simplex, respiratory syncytial virus, and herpes zoster. Use standard precautions and wear a gown and gloves. Engineering controls include providing sharps disposal containers and needles with safety devices, requiring discarding of needles with the safety device activated and the holder attached, labeling all biohazardous materials and containers. Work practice controls include requiring all employees to practice standard precautions, prohibiting eating, drinking, smoking, and applying cosmetics in the work area, and establishing a daily work surface disinfection protocol. Personal protective equipment, providing laboratory coats, gowns, face shields, and gloves to employees and laundry facilities for non-disposal protective clothing. Medical, providing immunization for the hepatitis B virus free of charge, providing medical follow-up to employees who have been accidentally exposed to bloodborne pathogens. Documentation, documenting annual training of employees in safety standards, documenting evaluations and implementation of safety needle devices, involving employees in the selection and evaluation of new devices and maintaining a list of those employees and the evaluations. Maintaining a Sharps injury log including the type and brand of safety device, location, and description of the incident, and confidential employee follow-up. Chapter 1 Review Questions. Number 1. Some responsibilities of the blood collector include correct patient identification, quality of the specimen, and correct timing for the collection of the specimen. 2. The recommended disinfection for cleaning blood and body fluid contamination is sodium hypochlorite. 3. Failure to become familiar with needle disposal equipment can result in an accidental needle stick. 4. OSHA requires employers of healthcare workers to provide employees with personal protective equipment, HBV immunizations, and needles with safety devices. 5. In the chain of infection, the susceptible host can also become the reservoir. Recognized accrediting agencies by the Centers for Medicare and Medicaid Services are the College of American Pathologists, the Joint Commission, and COLA. 7. The purpose of closing the centrifuge lid when in use is protection of the worker from broken glass. 8. Guaranteeing accurate test results, timely delivery of specimens to the lab, and quality patient care are examples of quality management. 9. The laboratory regulation agency that is made up of laboratory, industry, and government personnel is the CLSI. 10. A phlebotomy error that could lead to the death of a patient is misidentifying the patient. For further study, the CLIA is a governmental regulatory agency administered by the Centers for Medicare and Medicaid Services and the Food and Drug Administration that determines the requirements for persons performing waived, provider-performed microscopy procedures, monitoring complexity, and high complexity testing. Hand hygiene breaks the chain of infection in 4 places. In the chain of infection, reusing the same needle for a second puncture could cause infection in the portal of entry point in the chain of infection. Failure to correctly dispose of the contaminated needle could cause infection in the portal of exit area of the chain of infection.